When you approach your patient, you want to check for dangers first. Many first aiders get injured by jumping in and helping without looking. Look for electricity wires. Look for objects falling from the roof. Any danger to yourself. When you're sure it's safe, approach the person and gently shake him on the shoulder, saying, "Oz, Oz, can you hear me?" If there's no response, it means he's unconscious. Quickly roll him on his side by placing both hands in the direction you want to roll him. The nearest knee, try to flex it up, and that's your lever. Gently roll him over, supporting his shoulder and neck. Roll him over onto his side. Make sure the heel is in front of his kneecap so he doesn't roll on his face. That's what we call the lateral position. That in itself is a life-saving technique because every unconscious person loses cough and swallow reflex. So if I was to leave Oz on his back, he'd eventually choke and die. The next important thing is to check his airway. Open his mouth, check for any broken teeth, clear it out, any chewing gum, anything that may be obstructing his airway. Have a good look. Quickly check for breathing. Look, listen and feel for the breath against your cheek. Look for the rise and fall of his abdomen and chest. If he's breathing, check for his pulse. 2 fingers right alongside the Adam's apple, alongside the windpipe. You'll find his carotid pulse. To check that, you can also find his radial pulse on the side of the thumb, normally where your watch band goes. He has a good, strong pulse. The next thing to do is to check for any bleeding out of his ears, over his head. We're looking for that arterial bleed, the bright spurting blood, which is very dangerous. Look underneath him, go all down the body, quickly checking for any dampness, any wet spots, which may indicate hemorrhage. Check his ABC again. Make sure he's still breathing and still has a carotid pulse. Next, check for any fractures. Compare one side of the face with the other for any swelling, any movement, any dents. His ribs, his belly. This is the test for internal bleeding. If he has a hard belly, it's a sign that he might have internal bleeding. Compare his hips. Push the hips in together like that. If there's any movement, it may indicate a fractured pelvis. Check his airway, breathing and pulse again. Make sure he's still alive. Next, go all the way down his lower limbs, checking for any swelling, deformity, or any differences between one leg and the other. And the same with his hands and fingers. Check his airway, breathing and pulse again. Make sure the ambulance is on the way and keep checking his airway, breathing and circulation every minute until the ambulance arrives.
Road accident. Instruct someone to divert the traffic. Send for ambulance and police. Check for dangers, for example, traffic, petrol, car ignition on, naked flames, etc. Do not remove casualties from vehicles.
Okay, I'll put that in the chair. Go ahead, Will.
Is that kid around there?
Check for any unconscious people. Maintain their airway, breathing and pulse.
We can't move.
Constant reassurance to all involved.
Okay, I've got the neck brace on this patient here.
Just take it easy,
Treat
mate.
any bleeding. Treat for any fractures. Remain until help
Can't
arrives.
do it. Be truthful. I've got to...
Tell me what's not done.
Just hold that bandage at the front, please. Put your hand on, hold it firmly.
Right.
All right. Now, can you just gently take his head forward a little bit so I get behind him? Now, is that forward, over, right over
Yeah.
and forward?
Yeah, it's over his eyes.
Okay, just take it easy, mate.
The next thing I'm going to show you is how to stop bleeding from a head wound. And we use two triangular bandages, one folded up into a fairly wide, broad pad to stop the bleeding. We place that, first of all, on top of our patient's head and get his assistance. Alan, just put your hand on top, put some pressure on there, and that will help to stop the bleeding. What we want to do with the other triangular bandage is actually keep that bandage firmly on his head. And what we do, open up your triangular bandage with the apex or the point down like a scarf. Place it over his head. Take your hand away and place it on top again. Maintain the pressure. Make sure it's just above his eyebrows and on top of each ear. Now if you look around here, around the back, make sure the tail part is all the way down the bottom. There. Make one knot, making sure the knot's down as low to the nape of the neck as possible. Fairly firm. How's that? Good. Okay, take your hand away. Just go to the front and make a reef knot, which is right over left and left over right. That way you have the flat part of the knot comfortably there. Tuck it in on each side. Now the most important part about this bandage is we're going to now put pressure on there using this bandage. Grab hold of the tail and with your hand firmly on the bandage, pull downward. Notice the pressure there? And that'll stop the bleeding and you can let go and he has a pressure bandage on his head.
Fine.
Okay. Now look, he's breathing okay, his pulse is okay at this stage. All we'll do is we'll leave them in the car until the ambulance arrives and just keep a check on them all the time.
Fine.
Okay?
Yep. What's wrong?
Calm, rest and reassure the person.
Move your hands over there. Don't worry.
Do not wash the venom off the bitten area.
Come on, straighten your leg out. Don't worry.
Apply a compression bandage to the bitten area and limb.
Straight. Don't worry.
Apply the bandage up and down the entire limb.
Somebody want to get the bandages out of the sack?
The bandage should not be too tight. Do not remove the bandage at any stage.
You're going to have to straighten your other leg out.
Immobilize the limb.
Okay, you put the bandage on here. Okay, now pull it up. Yeah, you'll be right.
Seek medical aid immediately. what to look for.
Okay, just relax,
Swelling, discoloration, pain.
Okay, can somebody first aid kit?
First aid!
First aid kit, thanks mate. Okay, just relax. Just relax, you're gonna be fine.
Rest and reassurance.
Okay.
His leg up.
So just slow down. First get the ice pack out.
Elevate the injured limb. Place an ice pack and compression bandage onto the sprain. Ice should only be kept on the limb for 10-minute intervals.
Very fine.
When you're doing expired air resuscitation, hyperextend an adult's neck all the way down. Using your fingers, grip the jaw, pinch the nose, and give 5 full breaths with an open mouth. Check for the airway, breathing, and pulse. He's still not breathing, but there's still a pulse, so I'll continue on with 1 breath every 4 seconds. Do this 15 times in 1 minute and check the ABC, or airway, breathing and circulation again. If this is unsuccessful, you have to continue on for every 2 minutes. So every 30 breaths, 4 seconds apart, and you don't stop until the ambulance arrives. Many people give up, but never stop mouth to mouth until professional help arrives.
This man has stopped breathing. Unless oxygen reaches his brain in 3 to 4 minutes, he will die. Is the person conscious or unconscious?
Jason.
Shake, gently but firmly.
Jason, can you hear me, Jason? Jason. Jason. There's the response.
Roll person onto their side. Both arms facing same direction. Check in the mouth. Clear the mouth of any obstruction. Tilt the head backward with the mouth down to clear airway and allow drainage of saliva and vomitus. Look for the rise and fall of chest and abdomen. Listen for breathing with your ear to victim's mouth. Feel for breathing on your cheek.
He's not breathing.
Perform expired air resuscitation. Roll person onto their back. Hyperextend neck, that is, tilt the head backwards. Support the jaw with your hand. Give 5 full breaths within 10 seconds. Check for carotid pulse, using 2 to 3 fingers, not your thumb. Continue breathing, that is, 1 breath every 4 seconds. Recheck person is breathing every 2 minutes until help arrives. If breathing returns, roll person onto their side.
The principles of treating a snake bite or poisonous spider bites or any creatures like that, especially the ones you don't know, it's important first of all to trap the poison in the area and then immobilise the limb. What we do first of all is to find the bite site, It's probably painful, red, swollen. We don't wash it. Place a bandage over the actual bite site. And by doing that, what we're doing is we're actually trapping the poison in the tissues. That's where it goes. Then with a roller bandage starting at the bottom of the limb, if it's the foot, we start from the foot and go all the way up the leg. In the purpose of an arm, we start from the hands and the fingers and we work our way all the way up the limb. Don't bandage too firmly, but make sure that we bandage all the way up the entire limb. We then can immobilise his arm and transport him to hospital. The principle of this is that we are compressing all the blood vessels up the arm, doing no vascular damage, but also trapping the poison in the locality. The antivenin treatment will be given at the bite site, and this can save his life. Instead of collapsing after an hour with a deadly snake, he can last up to 4 to 5 hours with a bandage like that, and ample time to get to safety. So remember that, start from the bite site and then from the bottom of the limb all the way up.